it really close, and I'll try not to speak. Okay, welcome back. So, some of you actually had the experience of sitting in the hot seat as students. So, let me just go here, go back here. So you've now had the experience of being students and doing the first part of the case in a true PBL style, a fully student-centered style. That was the first tutorial as first year students. And what you may have noticed is that both of the tutors were doing a lot of guiding and questioning. When a group starts to take on those activities, so my group, I don't know whether you noticed, but in the first couple of pages I was guiding you. They'll put the key information up, or that's a hypothesis, or that's further information. But as we went on, I was actually guiding you less. And at one stage, I just turned up the next page, and someone read, someone got to the board, someone started to get the information going. Some of our conversations had to be in Vietnamese because the student group needed to talk easily. Yeah. So even in that first tutorial, I began by guiding you a lot, but I was actually withdrawing my guidance as you got more active. So I was role modeling how to do the PBL. So as groups get more experience, the tutor doesn't need to be quite so active, but they always need to be mentally active, listening. I was listening so carefully. And I don't know about you, but when I'm listening intensely and I'm engaged, I really look at people and I lean forward and I cannot stop myself from nodding. Okay? The problem with that is that as a tutor, everyone starts looking at me. And I don't want people to look at me, I want people to look at each other and talk to each other and question each other and not rely just on questions from me. So I have to tone down my engagement. I didn't do that in this tutorial because it was the first tutorial and I really wanted to encourage you all. And I felt that there were challenges in that first tutorial for you all. One of the challenges was that you were being first year students and you're not. And another challenge was you were working in your second language. So sometimes what I said was not clear. And then there was a conversation going on around the group about what did she say, etc. So it was a challenging situation. Even so, I was absolutely delighted with how well my group worked as a group and really engaged and trusted the process and went with me and got good diagrams on the board, good writing on the board. We had a progress from an initial little diagram that we weren't quite sure of to a really wonderful diagram, a beautiful tooth that had the enamel, the cement, the pulp, the roots, the blood supply, the sinus, the whole thing. I saw that both groups got that far. So much that people knew, and Jill and I both run this group, that tutorial with English-speaking tutor trainers just like you guys. And I can't think of another group that I've had that have actually gone all the way to an abscess, forming gas, the expansion when he goes with the altitude and he comes down. I have never had a group get that far. I was astonished. And yet, quite that far, and nearly got there, but not quite. So even though you had all those challenges and we're working in a second language, I thought the group worked fantastically. But I think what we now want to do is make clear the role of the tutor. Okay, so as I said, I was a bit more active in that group because I was role modelling for you, but gradually over time the group starts to take over the activities. So, well done everybody. The next thing is, now you are to be tutors. So you need to sit where I was sitting. Were there any things that you noticed that I did, if you think about the beginning of the tutorial, were there any things that you noticed that Jill or I did at the beginning of the tutorial and why that might be? Any behaviours you saw, any strategies we used? Particularly the people who were observing, did you notice anything? Where did we start? We started with the problem? Did we start with the problem?
No, I forgot.
You did?
I forgot to do the introduction.
That's all right.
And I admitted it at the end.
That's all right. That's because we were short of
I
time.
was running between two groups.
Yeah.
I get the sticker.
Yeah.
So
That's all right. So we did a quick kind of introduction and we talked about the icebreaker activity and just getting the group happy to talk with each other right at the beginning. Okay. And then we put the first case up and then I said, who wants to read? In fact, we actually said, it was the picture, wasn't it? And we said, tell me about the picture. So that's where we started our key information. And we rolled from there. Quite simple, so that's all you need to do. It's quite simple. Just roll with it. Okay, you're going to do it now. Not really. Okay, so we'll talk about the PBL tutor's role. Okay, what the tutor looks like. I don't know if you can see in that picture. Can anyone spot the tutor in that picture? Who's the tutor?
Lady close to the screen. It's easy for me to.
Yes.
Yes.
Ah, spot on.
So it could be
Yeah. But pretty much doesn't look much different to the group, is she? She's in the group. She's got a smile on her face. People are having a laugh. There's a couple of people up at the board. Everyone, though, you can see, there's no one there who's outside of the group, is there? That's actually a smaller than usual group, by the way. But everyone's in it. So it's all involved. I think this might be a report back. I think this is a report back picture. Yeah. So the report back is the piece when you come back and report your learning. So all of my group, you were off to learn the anatomy of the tooth and the types of infections of the tooth and the blood and the nerve supply and etc. So you would have come back and you would have done a report back and you'd be telling each other, I found this and I found that, oh, I found something different, etc. That's what they're doing. Okay. What we call this is a really nice functioning group, and Fuller is one of our best tutors. This is a performing group, but the tutor is what we would call, and this is a big term, but you'll see it in the literature if you read about PBL, is socially congruent. Do people understand the word congruent? It means fits in, okay? There is an ease. They are not superior, they are with the group, okay? It's more even, okay? Yeah. That is to create an atmosphere where students are not afraid to make a mistake. Students are able to say, I'm not sure, but maybe it's this. And I was really pleased with the group that I ran, that people were prepared to put forward and think maybe this, maybe that. And then we had a discussion between a couple of people. One person said, well, I disagree. I think it's something different. And that wasn't unpleasant. It was quite an even, nice conversation. We shared information, we debated a point. It was good. Okay. So that's what you're aiming for. Now, I don't know about you, but all of my experience before I became a PBL tutor was as a lecturer, like I'm standing now. And as I'm standing now, I'm talking to you from a point of expertise. Okay? I have done PBL for a long time. I did my PhD around clinical PBL, etc. So I have something I bring to the stage. And so I was used to being in the position of being right. And that used to stress me a lot, particularly when I was doing my pathology lectures and I was lecturing on a subject that was less known to me, and I had to read up a lot and make sure I'm right and nervous about questions. In PBL, I don't have that problem. I'm not a dentist. I'm not an expert in dentistry. I know that in the case when you do anatomy of the tooth, I know the terminology because I've been briefed on the case. But I wasn't an expert. But I knew enough that I could push you and question you. Why is that, etc. Okay, so I remember the sense of relief I had when I became a PBL tutor, and I didn't always have to be right. And I think that there's a good message in that, because as a doctor, sometimes it is safer to say, I don't know. If we always have to be the expert, we can get ourselves into trouble. Okay, so just some reflections. Okay, the tutor observes. I was observing a lot, and then guides. And the things that I was watching during that tutorial was the content of the learning, that you were doing your PBL tasks, you know, people were getting up to the board, scribing, writing the key information, I was keeping track of all of that, making it happen, and also watching the group process. You might not have seen me working so much on the group process, but believe you, I was. You might have noticed that sometimes when you spoke, I looked at you, and sometimes I didn't. Sometimes I looked at somebody else. That's because I was trying to get the conversation going between the group and not to me all the time. And I had to watch out the corner of my eye when I looked away at someone else to direct the conversation to the group, in case you were discouraged. So then I looked back at you, just to keep going, and then I looked back over and talk to your friends, okay? So managing the group behaviour all the time. Do not worry that you need to be an expert in this to begin as a PBL tutor, okay? I have been doing it for 30 years, so I have an ease about it, but I didn't at the beginning. Jill and I were sharing notes. Both of us were so nervous in our first tutorial, and we both sat there going, I'll just wait and see what happens. We were lucky because our groups were already established. Yeah. Okay, so those are the things you're watching. So you can imagine if you're watching those three things that are going on in the group, you get quite busy inside your mind. You're thinking a lot. So just to remind you, in case, you know, we're doing the activities, key information, hypotheses. Why do you think that's so? Okay. What else could it be? You would have heard both Jill and I asking those sorts of questions. Tell me about that. What is the mechanism? You know, so we had infection, we had inflammation, we had expansion and compression and pressure and, you know, sensitivity and a whole lot of stuff. And we really worked that hard. You would have noticed that the first page I worked the hardest, and then the new information just helps refine things. And we got to our learning issues. Initially, the learning issues were, I said to you, what do you think you need to know now? What are you curious to go away and learn? And so we wrote up anatomy, you know, etc. And then we said, well, okay, that's fine, but what's your question? When you open your anatomy book, what are you going to be looking for? So we refined the learning issue question. And of course now, you'll all go and read up on teeth, and you know, you would have your report back, and so the cycle would keep going. So it's your job to just prompt the students to the tasks. So then it's guiding the students' coverage of content. So I was listening to your explanations, I was listening to what you were saying. In that first tutorial, I was prompting you more than I like to, because I was guiding you to asking to a questioning style. Most of you would know about Socrates, yes? Socrates, famous Greek philosopher, very similar to Confucius and a number of different great philosophers across the world. And one thing that characterises the teaching of both, I believe, is the asking of the question. You know, so the person says, tell me something great, and then they frustrate them by saying a question, you know, etc. So, questioning, I was using what we would call the Socratic method. prompting you to make explicit your understanding. Can you explain that? Can you put that on the whiteboard? Probing the boundaries of understanding. How does that work? Can you explain that? Observing and encouraging students who have a question. So I was watching for the quiet person. Once, there was one quiet person in my group who was quiet because they'd come in late and needed time to get going. But once I saw they were going, I directly actually asked that person for a contribution, and then they fired. Off they went. Okay? I was using the case objectives to judge what areas to prompt and which to leave. For example, in our case, we could have asked you to, how do you name the teeth? What is the function of the teeth? How does a dentist record that? If that was one of the learning objectives, but it wasn't, so we let that go. Okay? And I was noticing the behaviours and concerns. So if I was working with you as a group again, I would know what you needed. And I guide the group process, as I was saying. Ensuring that we did process rules, observing the behaviours, paying attention to your dynamic. Both Jill and I realised that what you needed for your dynamic was to speak in some Vietnamese. So we both encouraged you to talk as groups in your native language so that you could share the ideas in a more sophisticated way. And I was trying to model good tutor behaviour, okay? Good learning behaviour. Okay, so the PBL tutor is a facilitator. Facilitates, I'm just repeating this just to kind of cement it. Facilitates the process, facilitates effective group functioning, facilitating safety, being at ease, there's those words, socially congruent. If you want to read about the PBL tutors, and I think it's in your pack, there's a paper by Schmidt et al. Medical Education, which is worth a read if you're interested in the theory behind PBL. I was familiar but not an expert in the case content, and I tried to work at your level. So when I was questioning you, I wasn't coming out with all the fancy words, because first you needed to find those fancy words for yourself, which many did. So we learned things like periodontitis, and people were puzzled by that and it got written on the board. You know, that's great. But we worked at your level, okay? So I'm a facilitator. I'm not a lecturer to lecture, to tell. I'm a facilitator. I question. I promote participation. I promote effective group function. And I monitor the quality of the learning, okay? I think we've said this. We did some establishing ground rules. I said, how are we going to work as a group? And we had a few ground rules, okay, as a group, about listening and respect, okay? We had a scribe. We took turns for scribing. So initially one person did, then we took times. If you were in a group for a long time, I would have a group secretary so I could communicate with you. We created a safe environment, and we had respect for each other, and that's what I tried to role model. I intervened when necessary. So I directed, I refocused, I asked questions, I asked a quiet student, I didn't have a dominant student that was a problem. I had one student who was probably more expert in the area than another, and so I said, you know, you're an important person in this group, because the group is now going to look to you for information. And it actually was quite deliberate. I said, perhaps you can use what you know to ask questions, okay? So I tried to role model questioning, constructive critique and reflection. Okay, so this is the important bit. You want to get prepared to be tutors, okay? So what we're going to do now is we're going to take you through a tutor briefing. Did we get those evaluation forms? Yeah. This one. No, this is not. This is more than 20 in the room. Hand these out. This form is, yeah, it says just take one and pass it back. We're handing out a form. You might have to have one between two. We can always have them printed for you. This is a form from Flinders. You don't have to have the same form. I just want to show you that when we have PBL groups, after a period of time, if I was working with your group for 4 weeks, 5 weeks, 6 weeks, 7 weeks, 8 weeks, if I was working with your group, after a time, one of our helpful people, like Han or Tam, would come and hand out a form like this, okay? And on that form, you will see, down this side some indications of tutor behaviour. And the students will rate me. The students will rate that. And then it will be put together and I'll get a rating. But I'll also get to see a summary form, not the individual student form, but a summary form. And I'll look at that. And that will give me a basis to know how well I am working as a tutor. Okay? So, and I have found this very, very useful. For example, after a few times as a PBL tutor, I got a form back that said, gave me a high score on most things, but a lower score on identifying and helping the group to resolve problems. Okay? And I realised that I had not done, and we'll be doing this tomorrow, any group feedback. Okay? So sometimes a group is working quite well or working not so well, and the tutor should take time to just say to the group, how's things going? Is there anything we would like to change? A chance for the group to discuss amongst themselves. Actually, are we happy how we're working? Do we want to try doing something differently? So that's the tutor helping the group with the process of the group dynamic. So that's a quick point. We can come back to this. But I find these forms very useful to give me feedback about how I'm tracking as a tutor. Okay? You don't have to do it this way. It's just an example. All right. What I'm going to do now is I'm going to, I think, hand over to Jill. Oh, I just did that. Okay, we'll go back to Jill. So Jill's going to take you through the tutor briefing. She's going to show you the tutor guide and take you through a typical tutor briefing.
Whilst we wait to get the slide, you've just been handed the actual tutor guide. What you were handed out first were just the slides. So now this is the official tutor guide that you would receive as a tutor. So it's actually got more information in it than you had. So whilst I'm just getting it up, thank you, sorry. Whilst I'm just getting this up on the screen, maybe have a really quick look through, flick through it and see what you can. Because you usually have this about a day or two, if not a week beforehand. I've got a few other things to hand out. We'll just take one and pass it on. If we don't have enough, we might need to share.
And there's another sheet, there's two that I'm handing out. Now in the tutor briefing is one of the key important roles of running a PBL program. This is where the PBL that we're doing is situated into the curriculum. So this is where you are informed what the students have done in the past, what the aim of this particular case is in the present, and what associated sessions are with it, such as lectures, clinical skills. They might have anatomy, physiology, dissection, or anatomy dissections. So this is situating it in the week, but not only that, it's situating it in the big umbrella of the topic that they're covering at the moment. What I want to do is show you a real case that we have in the second unit of work that our students have in their first year, which is equivalent to your third year of the undergraduate, so after the postgraduate. So I'd like you to remember that this is a complex case, but our students are graduates of other courses. So we pitch it to challenge them and push them. I very cleverly called this a name that I thought would resonate. Then I realised I had to pronounce it. So, Winvente? Winvente is a case that in Australia is exactly the same. So I've literally just transported this case to Vietnam. It is similar, everything is similar except where he is. So I don't know whether the full treatment that this particular man gets is the same. But that, as a PBL tutor, is exciting to me because then I get to learn about the variations that can occur. So I'd like to just show you this particular case is embedded in a unit of work called the Identity, Microbes and Defence. And it's something very passionate to me because as my science background, I'm an immunologist. So immunology is what I love. So this is my dream, these sorts of cases. So I really enjoy them. I have to sit on my hands and not give answers, and I have to allow the students to find them. It is situated, the whole umbrella of this course is in the hematopoietic system. So what we have is that I explain to the students, I actually go through this with them, that they will understand each branch, the erythropoiesis, the platelets, the macrophages. Then they'll start on the specific immune system, and then how do they talk to each other. They will go down each of these arms in this particular course. But the arm that we're going to be looking at is the macrophages and its communication with the specific immune system. The students previously to this particular case have already done some of this. And so you've actually got that written on your chart there. So in the first unit of work that they did at the beginning of the year, we've got HH, which is human homeostasis, they've actually already done a case on anemia, which required them to look at erythropoiesis. So we've actually covered that particular first branch. The next one that will be raised in this particular case is fever. Now they've already seen fever, they've already been human homeostasis. How do we control our normal temperature? What is the
diurnal range of temperature? What are the chemicals that stimulate that temperature? What is the temperature control point, and how does that modify by, at that stage they didn't know it, but now they're going to know, by mediators from infection. So then the next case in the IMD, in this particular block of work, is the hemostasis and fibrinolysis. So they've gone down that pathway of the platelets, which you've got in front of you there. Then they've actually looked at the innate immune system, so the non-specific immune system. So what are our first line of defences in our body? And in that particular case, they've actually looked at an acute inflammatory response with no medical help. So it's a pneumonia, and the pneumonia is healing by crisis. So the time that we see this patient has got all of the acute inflammatory markers that are firing off, and he's very, very sick. And then we do treating with antibiotics and he gets better. But we purposefully have this man in the outback of Australia, and he can't seek help. Because today, it wouldn't normally happen that way. So they've now looked at the first line of defences, and so they're looking at dendritic cells, they're looking at the role of the macrophages, they're looking at the complement, all of those sorts of things. So they would have had that in that particular case. Now, bearing in mind they're not experts in this yet, this is just giving them the information as we've seen in them. Then the next case is a humoral immune system. So that's looking at the B cells. We're looking at the antibodies, and it's we specifically have chosen here a rare case, and it's an A gamma globulinemia case, so it's a deficiency case. So the students have to go right back and work out the development of the B cells and where this person who we've got as a patient, who's a real patient, has his deficiencies and how does that present in the system. But this particular case, we're looking at the macrophages in the cellular immune system, and we're actually starting some of our microbiology. So the microbiology is TB that we're going to be looking at, and associated sessions, they'll have some lectures on it by microbiologists. They'll have lectures on the immune system by an immunologist. They'll have some clinical, looking at laboratory skills and how they can read the laboratory reports. And that's all going to be in here to reinforce all those accessory sessions. So that's a bit longer than we normally would do in a tutor briefing, because usually you would do a block of work. So these tutors would normally have come in at week 1 here, and they would be working through it. So I just wanted to put it into context where this particular case is. And you can also see where the other cases are going to go. So if there are learning issues that are raised, you can actually turn around and say, well, we're going to look at that a bit later on, so you don't get them so overwhelmed with it. So the other role is to walk you through the case. So I'd like you to all get your cases out. And basically, as a tutor, you'll walk them through it. So we've got, of course, the first photo, which is always very important. It makes it personable. And as you found out this morning, you do spend some time on it. And I do apologise, I didn't have a handsome photo of a pilot for today. Maybe I should adjust that one. So now, did you get that? Could you just turn to your page 3? As a tutor, I scribble all over my tutor guide. Whilst the briefer is talking, I usually have a highlighter pen, and I highlight things. Okay, so this is the student evaluation at the end. Now, in there you've got some different things. You've got where it sits in the component of the course, so you've got the knowledge, health and illness, you've got the public health issues and clinical skills. So this week is got all of these intertwined. And down on the right-hand side, you'll see that there's a C, which is for the case, so this learning issue will be achieved in this case. There are some with an L, which means that it will be achieved in a lecture. And then down further, there are ones that are achieved in the clinical skills laboratory. So you, as a tutor, will look at those and see how many hits that the student will have at getting this learning objective. So some of the learning objectives are quite, we know already that they've covered it. So listing of the causes of the fever is one. We know that they've already done a little bit about fever, but it does not hurt for them to refresh their memory. Some of them might say, oh, forgotten how fever works, how our body looks at regulating its temperature, so they might go back to their homeostasis notes and review them. The second one is about explain the mycobacterium and how it differs from other bacteria. So as you can see, there's a lecture there as well, and in the past I think we used to have a laboratory session, but I don't think that's as relevant anymore. So as you can see, we go through all of these. In this particular case, as I said, it's quite complex, and so what I'd like to do is give you a bit of an example as to where you might possibly get up to with your students tomorrow. Is it tomorrow? This afternoon. Yeah. So it's going to be, you're not going to do the whole case. So there's if you look at that, there's quite a chunk of microbiology in there, and then there's a chunk of immunology. So LO2 and 3, and 2 and 3 are pure microbiology. Then we've got what the body does to how it responds to the TB. So we're looking at the immune response. So that actually is looking at LO4 and 5. And then explain the rationale for investigations with a respiratory infection. So that will actually encourage them to go away and look at all different sorts of examinations for a respiratory infection. As you can see, some of these also have lectures with them. And some of these 7 is associated with 7, and then 8 and 9 are about the management. Now those management ones, I don't anticipate we'll get to today in your group. So I wouldn't be pushing hard to push them along too far. I would be looking at it and evaluating yourself as to how fast they're going and how good they are, how they're coping in it. Then the other ones that are very important that you might not get to today, but they might raise them as issues, are the public health issues. How are these infectious diseases spread, which is part of the microbiology part of it at the beginning, but then the public health impact they might not get to yet, but they might be curious, and that's what you want to capitalise on. There's also the comorbidities with it, and such as, especially in Australia, there's an increase in TB because of the increase in HIV. And so there are issues that we have in our country that I'm not sure whether are issues in your country. Then the clinical skills, we are aligning it with the case. It's a respiratory case, so we want them to look at their respiratory and physical examination. We've got some generic skills in history taking that we want them to rehearse again. Doesn't hurt. And then we've got understanding of the clinical reasoning and problem solving. So those are all things that are in the clinical skills environment. So now let's start the case. So the initial presentation, as we've had in all of the cases that we've been presenting to you so far, the first slide is actually purposefully very short. So we've got his name, we've got a bit about his age, and then we've got that he was sent by his GP, his local doctor, but he's presented with fever, night sweats and cough. Now it's really important to spend, as we did this morning with James, with those very few symptoms that we had, a good amount of time on here, because there are some things here that we have a fair idea how, what might be happening, but there are things on here that we have no idea how it really works. who don't really understand night sweats, for example. So we can have some theories put out, there can be some good discussion about it, but students might not know about it. They might say, oh, well, I might have heard about it. So what we want in this first slide here, we want them to start to think critically about what's happening. We want them to think laterally and brainstorm about what this could be. Pretty quickly, with the cough, it leads to the respiratory system, but there could be other things. They might say that, oh, he might have reflux and he's coughing. So there might be other things that they might put in here. That's okay. Put them up. Put everything up. And I said to my group this morning that it's better to put things up on the board, because if you don't, it just poof, goes into the air and disappears. It has to go up on the board so that you can all see what's happening. Then we go through it a little bit further, and we have his bit more information. Now, in the tutor briefing, we don't normally like to read through it all. We kind of give the gist of what's happening. So if I just give you a brief understanding of what's happening, because when you read it yourself, you as the tutor will get things in your mind as to how to prompt the students as well. So in this particular part, we're looking at that it's 3 months of duration. It's sputum. He's got sputum there. It's got different colour. It's occasionally blood-stained. He's a heavy smoker. They might have asked that in their further information, does he smoke? He's always had productive cough. He's got increasing pain on coughing, but he hasn't got any shortness of breath. So then he's also lost weight because his clothes were loose on him. He's also his family history here. He lives on a farm with his family, and his wife died 2 years ago, but he thinks of a respiratory infection. He relies on his family for meals and often eats poorly, and alcohol intake is unknown. So the students will be particularly interested in building a profile of this particular man. But as they are looking at it, they're thinking, well, why is he losing weight? Oh, is it only because he's eating with his family? Well, his family, I think, would be looking after him well. Is it something else? Oh, maybe it's an infection that he's got in his lungs that he can't deal with, and he's losing weight because he's got this underlying infection, so he's not feeling like eating. Or there might be some other underlying cause that they don't understand. I just need to slow down. Sorry. I get excited at these things. So, at this point, if you reflect back on the learning objectives, so far we would have already possibly have had learning objective 1 with regards to the fever, and that's about it so far. Sorry, one slide too early. Then we go and look at some of his physical examination. So his physical examination is the objective look at this person, and so we see that he hasn't got a temperature, his respiratory rates a little bit elevated, but okay. Blood pressure all right, pulse rate all right. He's got no cyanosis. Please, when in a group, you also should ask the students, do you understand these terms that are here? So they would have hopefully have come across cyanosis in the past, in the anemia case, but they might not have. So ask it again. And some people will say, well, I didn't quite understand it the first time I heard it. Can we go through it again? So some of these terms they won't know. Clubbing is a hard one to understand, so they might not understand that. A lot of my students want to know the mechanism. I don't have a mechanism for clubbing. It's not known. It's one of those things in medicine. Don't know. And he hasn't got any lymphadenopathy. Physical examination. Trick here is midline. Percussion right equals left. However, he's got decreased breath sounds in the right upper lobe. So that is a flag for the student. So he's got something going on in his chest. Some of these students might say, well, what's in the chest? We've got the lungs, we've got heart, we've got this. So this stage, they would have already done a respiratory case in homeostasis, so they could pretty quickly go to breath sounds mean something's wrong in the lung. Then we give them some bloods, and we sent a sputum sample off. The sample will be sent off for what is what I would ask the students, and quite often they just say, oh, to see whether there's any bugs in it. Then we've got this man here who's anemic, and as we look at this profile here, he's normocytic anemia. They would have counted that before, so then they will start to activate their prior knowledge about their anemia. His reticular count's normal. Is that normal? So as a tutor, you question these things. So this is looking at, when we're looking at our learning objectives, we're pulling in here learning objective 6, which we're looking at different investigations of respiratory infections. So we've got the bloods, we've got the x-rays, we've got the sputum going off. And then we're, of course, linking it in with the clinical skills for the respiratory examination. So then it comes back that the sputum is mixed oral flora with occasional polymorphs. The sputum is also sent out for a mycobacterial microscopy and culture. So we've basically started to say to the students, this might be what it is. And some of the students say, well, what is that? And so they will put that up as a learning issue. And so here, I anticipate, and I would like your students today to potentially come back with, go away with a learning issue related to what is a mycobacterium. So do a little bit of microbiology, basic microbiology on mycobacteria. And then as you'll see further down, there's one about how the microbacterium differs, that's number 2, how it differs from other bacteria, but also how it hides. So the students will come back with really good information about that, and they'll be surprised about it. Now I've got photos on the screen about that a bit later. Then the further investigations we actually do is a chest x-ray. He actually shows that he's got a right upper lobe cavity, his heart's normal. X-rays on screen, which I'll show in the next screen. So one thing a PBL case does is that everything is written for a reason, and if we say that the heart is normal in this case, it's really important that the students say, well, it's not a cardiac, we are going to focus on the respiratory system. So you are giving them cues all the time about where to go. So the sputum results, then we've got a positive for in a Z-Nielsen stain. Now I'm not sure whether that's still, whether you do that here. It seems, to me, it's the world standard, but I wasn't sure whether there's been an upgrade in being able to do that. So that might be something that your students come back with. They might come back and say there's different microbiology techniques now. Because that particular sample takes a long time to come back. So this case, as you can see, is condensed. So that again is looking at describe the clinical course. That's about the investigations of it as well. Then we have to ask the students. I'll show you. Now here we've got an X-ray. Now these X-rays are very, very old, so I do apologise. And the students might not be able to see it there, but I've got a comparison here, and they might be interested in seeing it. Students do like to have this sort of stuff up because it does make it real, and it is important to contextualise their learning in it, and it increases their curiosity. So we've got a normal, and now I'll just leave it there for the moment because I think that's about as far as you'll get. You might not even get to those. So if I briefly run through with you what learning objectives that we think that are possible for the students to get to today. And when you do your review of your case yourself, you might want to put notes where you think are the prompts to these particular learning objectives. So the first one is the fever, which was basically on page 1. The second one we start to get about explaining what mycobacterium is and how it differs from other bacteria, and then describe the clinical course from when we start to have the diagnosis of TB. However, you'll find students might say, I know, that could be TB, that could be something else. So students with their differentials up there might already have it up there, and they might not understand it, and you, as a tutor, can let that go up there, and they might say that they want to investigate it. So they might come up with it a bit earlier, and that's good, that's okay. Then, my passion is to get onto the immune system. So you might get them today to get onto the system, and that's really good. What's the first line of our defence against these organisms? And how does our immune system protect us? And does our immune system protect us too much that it makes it a problem? Granulomas. What's a granuloma? How does that form? What are the issues with it? These things. So our body is not perfect. We have things that they will realise, things that happen are to protect us, but it can do the wrong thing as well. So I anticipate that's where you'll get to, and I invite you to read the rest of the case and see how it flows on. But on the next day, tomorrow we'll ask the students to come back and do a report back, and the report back is where you get all the juicy meat, you get all the information that they come back with, and you'll see how much they come back with, and I hope you're surprised and I hope you enjoy it. Any questions?
Okay, so it's nearly 12 o'clock, and I'm told that no session is ever allowed to go beyond 12 o'clock because it's lunchtime. So I will see the tutors back here at 1 o'clock. At 1 o'clock, what you will have is time to read the case, and I will brief you on how we will run the tutor training process at that time. At the same time, Jill will meet with the students, and she'll get them warmed up and clued in about how to behave for your learning. This is funny because they're not actually here for their learning, they're here for your learning. So they'll act as if they're here for their learning, but we've tried to set the process up so it's about you. But they'll still do learning issues, and they know that they have to go away tonight and read up and be prepared to come back and report back for your learning about how to do a report back. So off you go for lunch. I'll see you back here at 1 o'clock. Was that too fast? Does anyone need it explained in Vietnamese? Too fast? It's okay, it's fine. Good, thank you.
Các bạn nào mà chưa có tài liệu á, mình để mình sẽ để